Vaccinate or test. Now let's move to the adult dog. Do I give it a booster dose just because it's time, or should I actually test? This is a question that is being driven largely by the client, not by the veterinarian. Now, if you look at this, I stole this from a website, titer before over-vaccinating. Whether or not you are aware, there is an abundance of anti-vaccination websites for pets. And this is one where that poor small dog is being attacked by about 15 or 20 syringe and needle to pulverize this poor thing, to make owners concerned, raise the concerns among owners about testing rather than just randomly administering vaccine. Now, what I've experienced is owners are concerned about things like pet over-vaccination, vaccine injury that largely stems from the purported autism, measles vaccine link, just unnecessary vaccination. I've heard this many times. You veterinarians are just giving vaccines for the money, and we don't really need the vaccine. It's not a real disease, that kind of thing. What I'm saying here is that as a clinician, this gives you an option to do an antibody test. It's a valid, reliable testing platform that gives you and the client information that they may be seeking. Now, whether or not you support this, but the client may be driving this in some situations. Now, what this ultimately has driven is yet another question, and this is relevant too. If you do a test on a dog that's due for a booster, the owner would elect to test rather than just randomly vaccinate. That question that comes up is this: if the test is positive today, will it be protected tomorrow, or a year from now, or 3 years from now? In other words, does a positive test look forward? Now, I want to challenge your thinking on this. A positive antibody test today means the patient is, in fact, protected for distemper, parvovirus, and adenovirus. But it also tells you something else. It is a sentinel test, if you will, for memory. In other words, if they've made antibody, they must also have memory. And these are B cells sequestered in germinal centers of lymph nodes that are going to remember for many years, probably for life, for the antigens we're discussing. If they see it again, they will rapidly, literally within hours, begin to boost themselves because they have memory. So it is an option to say, yes, we can test today. And if they are positive, we know they are protected. But we also know that in the adult dog, they have developed memory, and they will be protected for several years from this point forward.